right. Hello, Mr. Soriyama. How are you today?
Hello. I'm good.
So what brings you in?
Well, I've been having some hip pain recently. It's been bugging me, so.
Okay. So it seems, according to your intake form, that you're having some pain with your left hip. Is that correct?
Yeah, it's on my left hip.
Okay. And so, is there any activities that that kind of activate it a little bit more than others?
Usually, if I stay sitting and when I get up and move around, it feels pretty stiff and painful. Specific movements, if I bend my knee towards my chest, it hurts a lot. If I move out, internally rotate, it hurts a lot too.
Okay, so it says on here that you do resistance and endurance exercise about 5 to 6 times a week. So are those activities aggravating it more?
Yeah, I say specifically doing lower body exercises, I kind of have to be cautious of things that I do. And if I run too much, it kind of hurts too.
Okay. And so is this the first time that you've had an injury in that area? That left hip area, or is this a brand new injury?
This is a single injury that happened a couple years back.
Okay. And have you had any prior treatment for it? Anything to help with it?
I had 2 PT sessions, but that's pretty much it.
Okay. And how did you feel about those sessions? Were they helpful?
They were okay. I felt like I started progressing, but it kind of has its ups and downs, I guess, with pain.
Okay, so it says here resistance training. What type of resistance training do you like to do?
Usually with barbell, compound movements, squat, bench, deadlift.
Okay, and so would you say that in that squat motion, do you feel like that's helping it at all, or is it what makes it painful?
Usually at the bottom of the squats when I feel the most pain. It's kind of like that pinching in that front of my hip area.
Okay. Have you had any imaging done on it to kind of focus in on what's wrong? Any labs, any testing?
No, I haven't had any of those things.
Did the prior therapist look at it at all when you came in for treatment?
Yeah, I mean, he did some basic stuff. Move my hip around, see what was painful.
Okay.
But, yeah.
So, with that, what is your living situation like? So, occupation, what do you do for a living? Are you a student? Do you have a full-time job? Is it manual labor? Is it things that are, aggravating that site?
Well, I'm a student, full-time student, so I just sit in class all day.
Do you think that the sitting is causing or can cause some of the pain for if you sit a long period of time and then you stand up?
Yeah, usually if I sit for more than 45 minutes at a time, it starts to hurt after a while.
Okay. So with that, do stairs give you trouble at all? Do you have stairs that are in your house that give you trouble, or is it mainly, just the sitting for long periods of time and then getting into that deep kind of squat area?
Yeah, I mean, even with walking kind of bugs me. If I just stay stationary, sitting, and I start moving, so stairs would be kind of hard at first, but if I get that milking action with the joints,
Okay.
it helps, kind of makes it feel better.
So do you have stairs in your home setting right now?
I live on the 3rd floor of an apartment on the 3rd floor, so there's 2 staircases.
Okay. How are you able to deal with that? You're just used to the pain at this point?
Yeah, I'm pretty much used to it.
Okay. And so it says on your intake form that it was from a basketball injury. Do you still play basketball a lot?
Recently I've been started playing basketball again, and it does kind of bug me afterwards, but it's probably around 5, 6 out of 10.
5, 6 out of 10 pain? Okay.
Not too bad.
All right. So you're a pretty active person. Let's see. So, do you have any family history of, musculoskeletal injuries or any family history in general that could possibly lead to this?
No.
Are you getting have you had any major weight loss that's came from this, fevers, chills, sweats, anything of that sort that isn't very normal with a musculoskeletal type of injury like this that you've noticed?
No. Everything's pretty much normal.
All right, and the last thing on here, so it says that your pain gets best in the afternoon and worse in the morning? Is it just from, you're sleeping and you're in like that static position and then
Yeah.
you get up and move?
Yeah.
And then I'm assuming it gets better in the afternoon because you're more active during the day and you're moving around and it's not in that static position.
Yeah, exactly.
Okay. So it seems like you're coming in for pain with your left hip. You
Mhm.
don't really know what's going on. You're a pretty active individual, 5 to 6 times a week, resistance and endurance types of exercise, along with kind of like the basketball situation. Your injury happened approximately 6 years ago, and you're getting sharp pain with certain motions, deep squats, standing after long periods of sitting. What are you trying to get out of therapy?
Well, ideally, I'd like to decrease my pain level just a bit, just so I don't have to worry about it as much. Because for right now, I feel a little bit limited with certain activities, especially with squatting, and I feel it with jumping too. So to get that pain level a little bit lower, I think that'd be a good goal for me.
Okay. Well, seeing that you're a pretty active individual, exercising 5 to 6 times a week, resistance, endurance, you like playing basketball. Having a goal of decreasing your pain seems pretty realistic with just physical activity alone. What I'd like at this point is probably to get some imaging done so we can try to hone in on what's specifically wrong with you, or not wrong, but the diagnosis, so we can kind of go from there. Preferably an MRI, just because of what I'm seeing with the types of conditions and complaints that you're coming in with the intermittent pain and with it coming from certain motions such as that deep squat. So from there, yeah, I think you have a pretty good background on what we could do, and I look forward to helping you out.
All right, thank you. All right.